Good afternoon, everybody. Welcome to today's July 22nd edition of the COVID-19 situational update from Peterborough Public Health. Great to have you with us. My name is Brittany Cadence, the Communications Manager here, and we're very pleased to have with us several representatives from our enforcement partners, from the media, and several of our elected officials here today too. So to begin with an update, I will start with a moment to pause and respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Michi-Sagig territory and in the beautiful traditional territory of Michi-Sagig and Chippewa nations, collectively known as the Williams Treaties First Nations, including Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, so joining us, we are fortunate to have our Board of Health Chair, Mayor Andy Mitchell from Selwyn Township, to lead us off with some opening remarks. Please go ahead, Mayor Mitchell.
Thank you very much, Brittany. Today I'm going to direct my comments at the approximately 20% of eligible Peterborough residents who have not yet begun the vaccination process, and specifically to those who are hesitant to get vaccinated. For you, I have prepared a list of 10 reasons to get vaccinated. So starting with number 10, the Delta variant is many times more contagious than the COVID which emerged in the spring of 2020. Number 9, young people are now becoming infected in greater numbers than older individuals. 8, unvaccinated populations in other countries are being infected in large numbers. 7, the risk of COVID-19 is 4.7 times higher in unvaccinated individuals compared to those fully vaccinated. 6, new cases and outbreaks continue to occur in our community. 5, we want our kids to be able to return to school safely. 4, when exposed to someone who is infected, vaccinated people will be more likely to carry on normally and not have to self-isolate. 3, you will be able to travel outside the country and not need to quarantine upon your return. 2, getting vaccinated will help save the lives. And the number one reason to get vaccinated, the life you save by being vaccinated may be your own. Remember, public health and the community are here to help you. If you need information, we have that. If you need to better understand the risk versus the benefit, we can help you with that as well. If you need vaccine, we have one to give you. If you need a ride, we will help you get one. And if you're scared, we'll comfort you. Peterborough, City and County, has done a great job in fighting COVID-19 and getting our community reopened. No one wants to go back to the way it was in April or to have to face a fourth wave. The way to do that is to get your jab, and when eligible, get a second jab. Protect yourself, protect your family, and protect your community. Stay safe, be well, and in all things, be kind. Thank you.
Thank you so much, Mayor Mitchell. Okay, so let's move on to our current statistics, and I'll invite Dr. Salvatierra to lead us through these next few slides. Please go ahead.
Thanks, Brittany, and thank you so much, Andy. I have good news to share with you today. I'm pleased to share that our active case count has reduced considerably since last week and now stands at 5 cases, down from 19 cases last Thursday. There are 25 close contacts that we are following, and that's similar to what was reported last week. While it's been less than a week since the launch of Step 3 and too soon to tell if this can be sustained, the lower numbers certainly do mark a very welcomed improvement in the local COVID outbreak. Next slide, please. Here we show you our weekly case counts, and you can see they are finally going in the right direction after 2 weeks of very concerning increases. For the week of July 12th, there were only 2 new cases reported, and so far this week, we've had 2 cases reported to us. Next slide, please. We're showing you here the monthly totals since the pandemic began. And you can see the dramatic drop in cases over the past 4 months as our vaccination rates have increased. I'd be very happy, of course, to see a repeat of last summer when we had only 4 cases reported for the whole month of July and 40 days without a new case. Hopefully, with both the vaccines and with the public health measures still in place, we can keep the much more infectious variants of concern at bay. Next slide, please. More good news to share. We have only 1 active COVID outbreak in our community at this time, and this is in a congregate living setting. We've had 2 confirmed cases there so far, both of whom are self-isolating. We were testing again yesterday, and certainly we consider this outbreak to be stable at the time. We'll move on to a map of our case incidence rates. And as you know, we've been closely following ours, and I'm glad to report that ours has improved. You can see on the right-hand side that our weekly case incidence rate has dropped to only 1.4 cases per 100,000. That's down significantly from last week when we were close to 17 cases per 100,000. And I must say, very nice to see that we are well down below the provincial average case rate of 7.1 cases per 100,000. And I think that's where we belong. With this map, we are showing the case incidence rates over the last 14 days in the province. And you can see that Peterborough is in green, along with much of the eastern part of Ontario. We can also see how cases of the Delta variant are persisting in some of the other regions. It just gives us an indication of both how close these outbreaks are, but also how difficult it is to control the variants and why we must get as many of our community residents immunized as quickly as possible. We'll move on to wastewater surveillance. And just to remind you, the blue bars are the results from the Millbrook wastewater treatment plant, and the orange are from the Peterborough wastewater treatment plant. You can see Millbrook is not detecting any virus at all. And the city had a very low level detected on Monday. So we will watch very closely to see whether that is repeated or whether it increases, as that will be our most timely indication of how we're doing in Step 3. We're going to look at our vaccination data as reported at the end of yesterday's clinics. And while the overall rates are gradually increasing, certainly we've seen the pace of immunization plateau here in Peterborough, as it has throughout the province. Currently, over 102,000 local residents have received their first dose, which is about 1,300 more than last week at this time. And that works out to 78% of the eligible population 12 years of age and over having received their first dose. Second doses continue to dominate our clinic appointments. We had more than 12,000 people immunized last week with a second dose. And in terms of percentages, that means that now 63% of those eligible in our community are fully vaccinated. That's 2 weeks after they've had that second dose. And that is a 9% increase since last week. Next slide, please. While 63% of the eligible local population have received both doses, when we look at the entire population, and that includes children who cannot be immunized right now, it works out to about 56% of our entire population that is now protected, fully protected against COVID-19. If we hope to reach a 90% vaccination rate for those who are eligible, as the province is indicating we will need in order to reach herd immunity, it means that there are still at least 15,000 people locally who are eligible and need both doses. So here in this bar graph, we can see that the percentage of the different age bands that have received their first dose in purple and their second dose in green. And it certainly is improving. We are seeing improved second dose coverage in our youngest population, jumping from 18% last week to 31% this week. We are happy to see the increases in the 20 to 29-year-olds. It's increased from 33% to 44% for second doses this week. And even great to see that among the 30 to 39-year-olds, 50% are now fully immunized, up from 39% last week. So great progress. We just have to keep doing that. So while the local COVID-19 situation has improved, our work is far from over. And I think this slide on vaccination certainly indicates that. As our board chair, Mayor Mitchell, stated off the top, our focus needs to be on those 20% of our local residents, or those 15,000 people who are eligible, but who are not vaccinated yet. And it's not just a matter of achieving a rate at some point over the coming year. We certainly have a clear sense of urgency in doing this now, because the faster we reach herd immunity, the lower that pool of unvaccinated people available for the virus to replicate and to mutate is. The other advantage, of course, of reaching that 90% vaccination target quickly is that we can further relax the public health measures that are in place. We've heard that there are some who are hesitant because of concerns about the possibility of long-term effects from the vaccines, and I certainly appreciate their caution. This wait-and-see approach, though, carries its own risks of unnecessarily prolonging the pandemic and exposing those who are unvaccinated to the potentially serious health risks of COVID-19 itself. There are many reasons why the medical and scientific community is confident in the long-term safety of the messenger RNA COVID vaccines. Researchers have been working with and studying mRNA vaccines for decades. They've been studied for influenza, for Zika, for rabies, and other viruses. As soon as the necessary information on the COVID-19 virus was available, scientists began in earnest to design the mRNA instructions for cells to build the unique spike protein and to turn that into an mRNA vaccine. In addition, cancer research has used messenger RNA to trigger the immune system to target specific cancer cells. So decades of studying the use of messenger RNA have shown no long-term side effects. These vaccines are not expected to have long-term negative effects for a few reasons. First, most negative effects from a vaccine occur within 6 weeks of receiving that vaccine. Secondly, the mRNA that in the vaccine breaks down very quickly. It's gone usually in a matter of hours. But even if for some reason our cells did not break down the vaccine messenger RNA, our cells stop making the spike protein within about a week, regardless of the body's immune response to the protein. In addition, the medical and scientific community is confident in the vaccine's long-term safety because of the track record of Canada's vaccine approval and Ontario's safety monitoring system. Overall, this means the quality of our safety data and the confidence in the vaccine safety are exactly the same as other vaccines that have been approved in Canada. So I urge anyone who is 12 years of age and over and who isn't vaccinated yet to do so as quickly as you can. With the variants circulating, we really don't have the luxury of waiting and watching. We have thousands of children in Peterborough who can't yet get vaccinated. So in order to protect them and to get them back to schools safely in a matter of weeks, we need to create that ring of protection in the rest of our community. My team is doing everything it can to reduce the barriers to accessing vaccines. Clinics are open in the evenings, and we can now accept walk-ins for both first or second doses. We are pleased to announce that the youth clinic for those aged 12 to 17 at PRHC is also accepting walk-ins for both first and second doses as well. And remember, you won't have to pay for parking. More clinics are going to be coming to the county as well in August. We'll be back in Apsley on August the 3rd, in Buckhorn on August 7th, and in Millbrook on August the 17th. Plus, we have lots of Pfizer available for the coming weeks. For those of you who have second dose appointments booked in August or later, please reschedule them now. We need to get you into the clinics and immunized in July, if at all possible. We have the capacity and we want everyone to be protected as soon as possible. For those who prefer to walk in, please note that the mornings tend to be busier. So if you arrive in the afternoons, the chances are there won't be any lineups at all. But if you hate lineups, book an appointment because we have lots available. Our mass immunization clinics will begin to transition to other, more targeted ways of reaching our still to be vaccinated populations. We are planning pop-up clinics and exploring both mobile and drive-through options. In case you are getting tired of hearing from me about the importance of immunization, we have a short video clip of some of our other local experts who have some advice for all of us on the importance of getting your vaccine. Over to you, Brittany.
Thank you very much, Dr. Salvatore, and thank you to our local population of keen kids who want to get back to school and are encouraging us all to get vaccinated. Okay, well, now we have a chance to hear from our elected officials, and I believe Mayor Therrien is here with us today. So Mayor Therrien, if you've got some remarks to share, please go right ahead.
Thanks, Brittany. Not too much to share today. Just, that already hasn't been said by the chair of the Board of Health and Dr. Salvatore. Just encouraging everybody to get vaccinated. I'm at 2 weeks from my second shot, so I'm feeling good and looking forward to getting back out there. Things are slowly returning to normal, but again, we just need to be careful and not take advantage of that and make sure that we're abiding by all the public health guidelines that we're so familiar with now, well over a year into the pandemic. So I'll just leave it at that today and be around for questions after. Thank you.
Great, thank you very much, Mayor Therrien. Glad you could be here today. All right, so now it's a chance to hear from our reporters who have kindly joined us. So in looking down the list, let's start with Bill Hodgins from Peterborough this week and Mike Kawartha. So if you have questions for Dr. Salvatierra or our enforcement partners, please go ahead.
Yeah, for Dr. Salvatierra, please. You mentioned plateauing this area and some other possibilities, drive-in clinics and such. Is there a time frame on when the clinics at the Evinrude Center will be phasing out or cutting back or anything like that?
Well, we've actually had to start cutting back on the size of the clinics. We've been reducing the numbers of immunizers, given that we weren't full. We had empty appointments, so we have cut those back. I foresee that in the next week or so, we may actually be reducing the number of days that we're running the Evinrude Clinic. Again, it all depends on whether or not we get those appointments full. And so if people book into the appointments, we'll certainly be running at full speed ahead for as long as we need to. But we are starting to think about moving back into the multi-purpose rooms at the Evinrude, the banquet hall side rather than the arena side, as we don't anticipate that we're going to need as much capacity over the month of August. And we are starting to look at other ways of reaching our population in August. So looking at mobile and pop-up clinics. So we would be redeploying those immunizers from the mass immunization clinics into other types of strategies, including home visits. I mean, we have mobile teams that are going out to immunize people who are housebound and unable to get to an immunized clinic. So I would say that things will start to change very dramatically in August. And then we'll have to see whether or not the COVID vaccines are authorized for children. I mean, we're all still waiting for the results of the Pfizer trial in the pediatric trials. And then as soon as those trials report and Health Canada authorizes, then we'll be looking at potentially, again, keeping those clinics or using that type of approach to help reach the children in our population. So I'm not sure when, but definitely changes will start to occur by the end of this month and throughout the month of August.
Okay, thanks. My second question was just what you said about the children. So I'm good. Thank you.
Okay.
Thank you, Bill. Okay, Jessica Nisnik from Global TV News. Please go ahead if you've got some questions.
I do. Thanks, Brittany. Dr. Salvatierra, you talked about the wait and see approach. What would you say? I feel like what I've been hearing is reluctance over the continued mixed messaging. Well, I'd say continued because of what happened with WHO. And I know that's been clarified, but that has really put people off, especially when I've heard also that some countries might not accept mixed vaccines if you want to travel there. So what would you have to say to that?
Well, I would say that our own National Advisory Committee on Immunization, NACI, has made a statement reassuring us that the mixing of the mRNA vaccines is safe and effective. However, that said, if people had a Pfizer, and I know here in Peterborough, we were using Pfizer predominantly in those first few weeks in March. And if they've had Pfizer and they want to get Pfizer for their second dose, we have lots of Pfizer now here in Peterborough. And so there shouldn't be a problem in getting an appointment and getting that second dose of Pfizer if that's what they prefer.
But what about the travel aspect?
Mm-hmm.
I know that's,
yeah.
You know, if people are waiting to see what other countries are going to allow, is there anything you...
Yeah, I mean, right now, I think where the concern has been, Jessica, is that there are some countries that have not allowed the mixing of the two, the Moderna and the Pfizer. So as long as if you're a traveler and you're concerned about that, as long as your 2 doses are either both Moderna or both Pfizer, you should be okay. And right now in Peterborough, that is very possible. You can get the same dose, the same vaccine for your second dose that you had as your first. You can do it at one of our clinics, or you can go to a pharmacy. We do have 28 local pharmacies here in Peterborough that are offering either the Moderna or the Pfizer. So you can shop around and get that vaccine that you prefer. But I want to reassure that everyone who has had a mixed dose, that is perfectly okay.
So then, Dr. Salvatierra, does it mean that if you show up at, I know online it was saying what pharmacies were offering what, but so if you showed up at the Evinrude, would you have a choice? Like, do you have Moderna and Pfizer on hand, or is it just one per day that you have available?
We typically have the one per day, and the reason for that is that we, in order to reduce errors, it makes it's better practice to stick to a single antigen or a single vaccine. But I think the reluctance, as I said, the experience in Peterborough here, Jessica, in the early weeks was that we were using predominantly Pfizer. And so I believe that there are lots of people out there who've had a first dose of Pfizer, who may have been waiting or prefer to wait until they can be guaranteed a second dose of Pfizer. And right now in Peterborough, that is the case. We have lots of Pfizer available. And so if that applies to you, then now's your chance to go out there and get your second dose of Pfizer, if that's what you prefer.
Okay, just 2 more questions, Dr. Salvatierra. You know, you're saying 15,000 people. I know that HKPR, I sat in on their call yesterday, they have quite a bit. Do you think that we've reached a point that whoever is going to get vaccinated is now vaccinated? And what are we going to do to convince those who don't want it?
Well, I think there are 2 groups of people out there, that 15,000 is not one group of people, that there are people out there who have not had the time or the convenience. Maybe they don't have transportation, maybe it just hasn't been a priority, maybe they have some unanswered questions. So I think there is a big part of that 15,000 that will be immunized if we can make it easy and convenient for them, and if we can address any concerns or questions. And I think primary care sector, our family doctors and our nurse practitioners can really help us reach that group because they have the relationship with these people. They can answer their questions, and I think there's a relationship there of trust that can hopefully enable those conversations to take place. There's probably in that 15,000, there's some people who are not interested in being immunized, and I don't believe that we can change their minds. I'm not going to spend a lot of time and energy. I will address any misconceptions or any myths that are circulating about the COVID-19s, and I will continue to provide people with good information and reliable sources, and all of that's on our website for people who are genuinely curious and wanting to know. But in the end, I don't expect we'll get to 100,000. 100%. I certainly hope we can get over 90%. But there will be people who choose not to be immunized, and I respect their decisions.
Okay, last question, Dr. Salvatierra. Yesterday at HKPR's meeting, they talked about potentially canceling second doses because they have second doses, well, canceling after July to force people to book sooner, because they said between August and November, they have 10,000 people booked, and they want them to push ahead. So is that something we would consider? And also, you know, what they said was if they don't do it, the government might. So
Yeah, we aren't going, we haven't gone that way yet here, Jessica. We have done an email blast. We're using robocalls to try and reach people. And I think if that fails and we still have people with second dose appointments booked after August, I understand that the province has offered to help us call these people individually, that they would deploy some of their staffing at the provincial level, at the provincial call center, to help us reach out to those people and help them get an earlier appointment. So I hope we don't get to the point where we're just going to cancel the appointments out from under them. And I think we still have a few other things we can try first.
Excellent. That is it for me. Thank you for your patience. That was a lot of questions. Thanks, Dr. Salvatierra.
You're welcome.
Thank you very much. Okay, Joelle Kovac is joining us from the Peterborough Examiner. If you've got some questions for Dr. Salvatierra, please go right ahead.
Yeah, I was just wondering about whether there's a higher rate of vaccination in certain areas of the health unit's jurisdiction compared to others, and
Mm-hmm. Yes, in fact, we have been able to use postal code data, Joelle, to look at whether there are geographic variations throughout both the city and county. And we have seen that there are some postal codes where the rates of immunization are lower. So here in the city, for example, in the southern parts of the city, I believe we've got lower rates of immunization. And out in the county, we're seeing that we've got some lower rates around the margins of the county boundaries where we overlap with our neighboring public health units. And certainly there seems to be more of that in the east as you're going towards Hastings. So that part of the county. So we are going to be targeting those geographic areas with pop-up clinics, potentially mobile clinics, but we're also going to work with our primary care sector because they also, I mean, many of these people are their patients, and I think that having that invitation from your family physician or nurse practitioner, if you have a family physician or nurse practitioner, I think that might help as well.
any theories as to why certain areas have, do they just have less access, do you think, to, or not?
I mean, I'm not certain as to why certain why we have the geographical differences. We know they exist, and you know, I think the important lesson in this is that we have to be prepared to make the vaccine as easily available, as convenient as possible. I think another way that we're going to hopefully reach some of these populations is through our pharmacies, because we do have pharmacies throughout the county and certainly throughout the city that are also offering vaccines, and they have very convenient hours, and people often go there to pick up many different things. So we're hoping that the pharmacies can help us reach these populations as well.
That leads into my next question. I was wondering whether the data available to the health unit counts, takes into account that many people may have gone to pharmacy, like, yeah.
Yes, in fact, we get that data for internal planning purposes from the ministry weekly. They let us know how many doses that our pharmacies have delivered and which vaccines they've immunized with. But then because all of the data is entered into one database, and that's the COVAX Ontario database, and it actually identifies the public health unit of the individual who was immunized. So those numbers that are being done by pharmacies, they're reflected in our totals.
Okay, thank you so much. do you have any update on when you get to take your well-deserved retirement?
I'm still waiting. I know the board is hard at work, Joelle, on finding a replacement, and I'm keeping my fingers crossed that they will have landed on someone hopefully in the next few weeks.
Good luck to the board. We'll have a hard time. Okay, thank you.
Thanks so much, Joelle. Okay, Reg Watson from the Examiner. Any follow-up questions for Dr. Salvatierra?
Just double checking whether any data is available yet on the most recent cases and whether they involve people who are vaccinated or unvaccinated.
Well, in fact, Reg, I have seen the data for the last 2 new cases, and it's an interesting, both of them had their first dose, but only days before they were infected. So they hadn't had their first dose long enough to get even partial protection. So essentially they were unimmunized because the transmission occurred so soon after getting their first dose.
And have there been any trends then on what the ages are of the most recent cases? Are they different than what it was earlier on in the pandemic?
That's a good question. And, you know, we haven't really been sharing the age based analysis in the last few media scrums. So I don't have it at my fingertips, but we certainly would have it, and we'll get it to you.
Okay, thank you very much.
Thanks, Reg. And we do have on our tracker the bar graph that does show how the cases break down by age band. And if you just hover your mouse over it, it'll tell you what the number of cases is for that age band, and then you can compare it as time goes on. So, but we can certainly look to bring that back for the next media scrum.
Yeah, why don't we look and see over the last 3 or 4 weeks what the age breakdown of our new cases is.
Okay, I flagged that. Thank you.
Thank you.
And thank you, Reg. Okay, Matt Latour from several of our local radio stations. If you've got some questions, go right ahead. There's so many.
You're everywhere, Matt.
I guess so. I don't know. I don't feel like it all the time. I don't move a whole lot. My questions are all for Dr. Salvatierra. First off, just piggybacking on Joelle's last question about your retirement. I just figured you were waiting toward 0 active cases and then you're quitting while you're on top.
That's a very good strategy. Maybe I'll keep that in mind.
I know that you had mentioned that pharmacy vaccinations are included in the public health data. Does your data also include residents that live in Peterborough but may have been vaccinated in another health unit?
Yes. So we capture both of those. We capture the fact that they are live here and are immunized, and that the immunizing health unit, as we do, tracks that as well. So they know how many people from outside their health unit were immunized.
Now we're about almost a week into step 3 of reopening. Have you liked what you've seen, whether it be downtown or just around town, as far as, people still following regulations?
Yes, I mean, I went for a walk this morning and I was glad to see that on the crowded sidewalks where you can't maintain distance, that people were wearing masks. I saw one gentleman get out of his car and then say, "Oops, I forgot my mask," and he went back and got it. So yes, I like what I see. And as I said earlier, I am looking very closely at our wastewater surveillance data right now, because that will be our first indication of what's of increased transmission if that's occurring. So watching that very closely.
As far as reopening goes, I know there's only 3 steps to the province's plan, and now we're in the 3rd step. So what's next as far as reopening?
Well, I think that's the $1 million question, Matt. We don't know. I know that my medical officer of health colleagues continue to provide input and recommendations to both our Chief Medical Officer of Health and to the government on what needs to continue beyond step 3 until we do reach herd immunity, because as you heard earlier, 80% of people of the eligible population with a first dose and 75% with a second dose, and no public health unit with less than 70%. Those right now are the indicators to move beyond step 3 and into whatever is next. That is not going to protect us enough, not with the variants. And all you have to do is look around at other parts of the world to see what's happening with the resurgence of cases. So I strongly believe that we will need to keep public health measures, at least some of them, in place as we move into whatever is beyond step 3, and that we also need to get to that 90% uptake before we can start to have any confidence that we have enough of a wall of immunity there to keep the virus at bay.
I know one of those measures is probably masking. And I know I've had a few people ask me at the radio station, like, hey, when can we take our masks off? And I say, I don't know. I'm going to ask her on Thursday. So my next question is, I guess, when do you think is a realistic timeline for the mask mandates to be lifted throughout the province?
I don't know the answer. I'm hoping we will continue masking in the context of having people who are still not immunized. As you know, the PHAC guidance right now for people who are fully immunized is that when they are indoors with other people who are fully immunized, that they don't need to wear their masks. So I think for people who are fully immunized, that right now there is some relaxation of those of the masking recommendation, as long as they stay with others who are fully immunized. But as far as a public health measure, when you're out and about in public spaces where you don't know the status of people's immunization, I hope we continue to use masks into the future for as long as we need to.
And my last question, although it is a little ways away, I know the Ontario Science Table has said a lot about schools lately and how they like to see students back in schools. I assume that this is something that you would be excited to see as well? I'm very eager to see children and students back in school learning in the classroom. And so I certainly, it's an area of both interest and active engagement for me, because I chair a provincial group of medical officers of health that working on the issues of reopening schools. And so we consult with both the Ministry of Education as well as the Ministry of Health on a regular basis. In fact, we had a meeting early this morning. So it is an area of active interest for me. And I certainly will do whatever it takes to see our local schools open up in September and have students back in the classroom. That's it for me. Thank you.
Thank you, Matt. I see Joelle has a question, a follow-up question. Please go ahead, Joelle.
I think the mayor is still here. This is one for the mayor.
Okay.
Yeah, I'm here.
Okay, great. Your worship, is the city still under a state of emergency?
Yes, so formally we are. That's something that I know, the emergency control group continues to meet weekly on Wednesday mornings, and the work that's being done by the built environment and various other subcommittees continues to happen. We do discuss this weekly at the emergency control group meetings, and I believe it's around half of municipalities in Ontario remain under state of emergencies, and the county of Peterborough currently does as well. So we're hoping to work together with the county on timing when we decide to lift that state of emergency.
Okay, only you have the authority to lift that. Is that right?
So I didn't need council approval to implement it. I know that council does want to have a broader discussion about lifting it. So ultimately, while I do have that authority, we do want to make sure that it's everybody on council is agreeable to that. And like I said, also working with the county to make sure that we're on the same page, as well as with Hiawatha and Curve Lake First Nations.
Okay, and what sort of changes will happen when that's lifted?
At this point, that's a good question. At this point, it's you know, it would, for the average citizen, you wouldn't really notice. You know, what it does internally at City Hall is it does implement, like I mentioned, that emergency control group, and for decision making that, you know, doesn't necessarily need to come to council. So we saw that with some of the changes that were made in the last year around, again, built environment, transit, those types of things. But for most people, you know, I would think most people aren't really aware of whether or not we're in the state of emergency. So there wouldn't be much that changes externally. It would be more internal meetings and subcommittees.
Would that be a discussion that you'd have with council in public, or is that not for public?
Yeah, it's not a closed session thing. No, it would be an open session. I mean, it's come up a few times at council meetings over the last year, so it's definitely a public facing discussion.
Okay, that's it. Thank you very much.
Great, thank you, Joelle, and thank you, Mayor Therrien. All right, I think that brings us to a close. Thank you all for joining us, and we will be back here next Thursday, July 29th, to provide the latest on the COVID situation. So appreciate everyone's time today. Oh, Matt, you've got a question?
Yeah, one last one for Dr. Salvatierra that I didn't see written on my sheet.
Oh, okay, I think she's still here.
I'm here.
Perfect. It just had to do with the upcoming August long weekend in a few weeks and whether or not with vaccination rates going up, you're still concerned about the possibility of a spike in cases after a long weekend.
Well, that's always a possibility, especially as people move about. Because remember, we carry the virus; it doesn't have legs. So I think, and we've learned from experience, Matt. If you look back over the course of this pandemic, I think almost after every long weekend, we've seen spikes. So let's hope that this time we can prove we can change that. Let's hope that people are immunized, and that would be another incentive for people to get immunized now, you know, with their second dose, because we all know that the Delta variant needs that second dose if you're going to have enough protection against it. So it's a great time. Thank you for asking that question. I think it's great planning if people can think about the long weekend in August and go to a vaccine clinic and get that second dose as part of that planning.
Perfect. Thank you.
Okay, great. Thank you both very much again. All right, that does bring us to a conclusion, and thank you all for joining us. We will be sure to post the video clip from today's session up on our YouTube channel by the end of the afternoon. And wishing you all a wonderful afternoon and enjoy that beautiful day out there. Thank you.
Thanks, Brittany.
Thank you,
Thanks,
Brittany.
everybody.
Thanks, Brittany.